We have been seeing how contentious vaccine mandates and COVID restrictions are in the United States. Some Republican-controlled states, in some of them, vaccination drives are effectively stalled. Top American health officials now call COVID a pandemic of the unvaccinated. And in the midst of all of this, the U.S. Centers for Disease Control is giving the green light to third doses for millions of Americans. In Washington, Magda Gabrisalasy, she has the details on what the CDC announced late last night. Magda.
Hi, Heather. So the decision is going to impact millions of people, and it has to do with Pfizer-BioNTech COVID-19 vaccine and the booster shot, essentially. So there is a list of people that are now eligible to get this booster shot. The FDA gave its approval earlier this week. Now you have the CDC, and we have a better idea of who can actually get this shot. And that includes, of course, seniors topping the list, also people living in long-term care homes, and people who may have underlying health conditions. And that also applies to those who are 18 and up. So it's not just the older population, but younger people that have health conditions, concerning health conditions as well. But there was some friction when it came to including one particular group. So the panel that was advising the CDC about who should be getting these booster shots actually voted against including workers that are in settings where they may be exposed to COVID-19. Well, the CDC director decided to go against that, making the call to include frontline workers when it comes to getting this third shot from Pfizer-BioNTech. And so we're talking about healthcare workers, teachers, people who work in prisons and shelters as well. And that's anyone that is 18 years of age and up. So here's more from the CDC director, Rochelle Walensky.
I'm approaching this decision with an interest in doing what's right for the public health. We remain committed to continuing our robust efforts to vaccinate as many people as possible.
Now, initially, Pfizer-BioNTech wanted this to be to expand to a greater number of people. They wanted the booster shot approved for anyone age 16 and up. That isn't happening right now, but experts say don't rule it out down the line in the future. Here's more from Dr. Lena Wen on CNN.
I think it's reasonable to start the rollout with them, and then to, as more evidence comes in, also to recommend boosters for the entire population.
So right now, this decision, again, it's just for Pfizer-BioNTech COVID-19 booster shot, the third shot. This doesn't apply to any of the other vaccines or any of the other companies. But we do know that Moderna, Johnson & Johnson are also pretty interested in this booster shot. They've got their own data to suggest that there is a need for this. Moderna has already approached the FDA about it. Johnson & Johnson not yet. So at this point, it's just Pfizer-BioNTech. And for anybody who may have, received one of the other vaccines and is thinking, well, maybe I can get the booster shot from Pfizer-BioNTech, that can't happen here. There's no mixing and matching of vaccines, Heather.
I thought that was a really interesting point because we've talked about how the mRNA vaccines are interchangeable. With the boosters, they say no mixing and matching, as you point out quite rightly, Magda. Mentioning, as I was earlier, the struggle in the United States with the vaccination drive, the numbers really stalled. How quickly would third doses start going into arms?
This could move pretty fast because it's actually interesting. Health officials were prepared to get these booster shots out as early as this week, but the approvals weren't in place. So they were just waiting for it to be approved by the FDA and the CDC. Now that that has come in, we could expect for this to move along pretty quickly. And there is a COVID-19 team update later this afternoon, so we should probably be hearing more about that.
Magda, thank you as always. Magda Gabrisalasy in our bureau in Washington.